Let's bring him in, Dr. Joe Congini, Sports Medicine Center at Akron Children's Hospital, with our weekly visit with Dr. Joe. Good morning, Joe. What do you have for us this morning?
Hey, Ray. How you doing this morning?
Excellent, my friend. How are you?
I'm good. I just wanted to kind of update probably about the injury as it relates in professional sports in Cleveland that worries me the most, and it's one that worries us when we're in the office with high school athletes and junior high school athletes and college athletes. Occasionally, we see that the vast majority of concussions get better in a few short matter of days and weeks, and there's a few that last longer than that. And the issue of what's going on, and people ask me all the time about Denzel Ward of the Cleveland Browns. As you know, I don't have any inside information about what goes on with these, but we kind of use these as an example. And when you see somebody in a situation like Denzel Ward coming up now on 4 weeks that he's been in the concussion protocol, as you try with other injuries to kind of read up what's going on, they may be telling you about how they're rehabbing or how the studies are going and what their projected time back is. But unfortunately, as we've mentioned many times, with concussion, it's very hard to draw out a timeline and know when these athletes are going to be back. And when it gets to be several weeks and you don't hear anything except that athlete is in the protocol, it's somewhat worrisome. And so, there's different stages in the protocol, but what happens if athletes continue to have symptoms of concussion, they stay in the same stage. They don't move on and move towards getting back towards playing. And so that part's really frustrating. And, somebody really smart in the clinical world was asking me the other day, well, aren't there any objective tests that you could look at to get a sense of if they're progressing and moving towards playing again? As I was walking with, my brother, who's a longtime doctor. And no, in other areas of medicine, there are good tests that lead us to what kind of progress are we making. And in concussion, not so much. And also what makes concussion so difficult, and we don't know this at all with Denzel Ward or other patients of ours, though, that are in the office, there's different types of concussion. There's the ones that are prominent with the headache, the migrainous type, migraine headaches. There's the balance concussions where that's called vestibular symptoms that the athletes have. There's ocular or vision symptoms that athletes have. There's the type that are called cognitive concussions where they have problems thinking and problem solving and reaction time. And they're just not improving over that period of time sometimes, and they are kind of stuck in the protocol. And when we get out now, we're at about 4 weeks with Denzel Ward. That's concerning. And then the other thing, of course, that I think people know and read about in that particular case, and with kids down at our office too, is if kids have had previous concussions. And in the case of Denzel Ward, they have been talking about, as I read some of the articles, he's had at least 3 documented concussions. He's very young. He's 25 years of age. But he may have had, when they say documented, he may have had other ones that were questionable, and you just don't know, at other times of his career where he'd been. But the really concerning thing overall is the talk as things move on, and a few athletes have done this. If they start moving down that road too far, there's players like Luke Kuechly, the great linebacker from the Carolina Panthers, who retired, and Chris Borland of the 49ers, and people talking about with Tua and other things. And so Denzel Ward really would be a really important part of the Cleveland Browns' future. They really paid him a lot. It's very hard to find cover corners, but I'm concerned, and especially now with the bye week off, if there's not movement through the concussion protocol at the end of the bye week with an extra week off, that would be really concerning to me too. So just like athletes that are in our office, that they kind of get stuck in the protocol, we often need other specialists like neurologists to help us. Or there's physical therapists, and I'm sure there's physical therapy that could be going on depending on the type of concussion that Denzel Ward has, like other athletes of ours in our office. So they're trying probably different types of different specialists that are seeing him, and different types of therapy to see if he is responding to those things. But right now, it sounds like he's somewhat stuck in the protocol. And for a young athlete like that, it's pretty concerning.
Yeah, you want him to be healthy. You'd like to see him play football, but he's a person first and foremost, and then a football player. Good stuff this morning, Joe, as always. Always appreciate the time, Joe.
Okay, Ray. Have a great week. Thanks a lot.
You too. Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital, with us at 93.5, 1590 WAKR.